I did want to give a shout out to the plenary speaker, which is going to be awesome, and I think that has another angle for social media, because I think that I think it's important to look back before you look forward, and the plenary speaker, which will be on Thursday morning, is Gail Stevens, the man. I mean, he's the guy that, I mean, when I talk to family docs who know him or have known him personally, and I've read a lot about him, he's the social media guy of his day. I mean, he's the guy that kind of started out the whole thing, and very inspiring. And I've heard his articles and writings quoted for a long time. And I think social media has opportunity to, tell his story, retell his story to people who have never heard about it before. So that the plenary speaker, I'm looking forward to hearing Dr. Stevens speak.
Yeah, I'm stoked that he is able and willing to come and speak with us. I think it was back in early 2011 in one of the STFM journal articles. There was a kind of a biography of and a timeline of Dr. Stevens' influence in family medicine. And as I was leafing through that article, I fell upon one of the columns, one of the subtitles in the article, and it said, family medicine is counterculture. And of course, I immediately got even more interested in the article and kind of poured through that. And, in 1979, Dr. Stevens talked about, framed family medicine as coming out of counterculture movement in medicine that really kind of got out of the doctor-centric model of healthcare, meaning, you know how it is. When you go to hospital, sometimes the doctor's parking is actually closer to the hospital than the patient's parking. And that's,
Right.
That, to me, that just is so wrong. But kind of talking about family medicine as a counterculture, how it kind of came up out of the 60s, and wanting to have medicine be sort of different than sort of the medical industrial complex that was coming out of that era in American medicine, and how really the first struggles that we had as a specialty, as a medical specialty, were for legitimacy within the house of medicine. And and the irony in that is that we're still doing that to this day. That battle hasn't ended. It's something that we continue to do, whether it be at the AMA or at the RUC, which is another topic you've talked about, the relative value scale uptake committee that determines physician rates, and that really resonated with me. And actually, there's a meeting that I've gone to the last 3 years where they actually have a G. Gail Stevens lecture because he's somebody that used to come to this meeting, and that's the National Conference on Primary Care Access. And there's a lot of sort of the godfathers of family medicine that have been to this meeting in the past. And that was a great history lesson for me. And as Callie Castro and myself were laying down plans for the NCSC meeting, I thought, well, I wonder if there's a chance he would say yes to coming out. And sort of in that counterculture fashion, he was actually very suspicious of what we were trying to accomplish.
Trying to counterculture his counterculture or something.
Right. And so I was like, all right, I better give him a phone call because we communicated by email in the beginning, and he asked all these questions about what it is that you're doing.
So wait. So you called him, and you're the one that made the pitch to this guy?
That's correct.
Wow. You are the convener, buddy.
Well, we weren't well, here's the deal. Because he was asking all these questions, and I I was getting feedback from the staff, and I just said, you know what, give me his phone number. I'm going to call him. And so I gave him a call. I set up the meeting via email, which is cool. And I set up the meeting, and I was nervous. My palms were sweating.
I would be too.
I had I was tachycardic.
Yeah.
I felt like I had to go to the bathroom.
Yeah,
you know?
exactly. Right.
And I call him at the agreed upon time, and I introduced myself. I said, "Sir, this is Dr. Jay Lee from the National Conference of Special Constituencies. Really honored to speak with you, and I wanted an opportunity to answer any questions that you may have about the meeting." And we proceeded to actually have probably like an hour and 15-minute phone call where I explained to him what's happening in social media with Family Medicine Revolution, and how, our generation of physicians is looking to the historical bases of what we're doing today, and to kind of help tie that story arc, going back to the narrative. How do we tie that story back to the early days of family medicine? And when I explained that to him, Dr. Stevens' answer to me was, "Well, I don't see a reason why I shouldn't be at this meeting. I must be there." And
oh man,
and of course I was like, "Yes, this is awesome." And he was very excited about the fact that there are segments of populations of family physicians that get what he was talking about back in late in the spring of 1979. And incidentally, what is it about spring and revolution anyway?
Right.
But
exactly.
there seems to be a great sort of history of spring being correlated with revolutions. And so, it's perfect that this meeting that we're having is in the spring. I think it's great that we've got Dr. Stevens to come and speak to us about the history. And he's a very, very academic individual, and very analytical. And I think, we're going to have a very clear sense of exactly where family medicine has been, where it is now, and now that he has a sense of where we're going, because he's been long retired. I think this is going to be an amazing journey for us to listen to him, and I'm really hopeful that those of us who are on Twitter are going to get out there and tweet this out, because I think it's going to be a really thought-provoking and inspirational lecture.
I really hope that you tell that story, out there, as far as, even you, Jay Lee, legislative expert and NCSC convener, still gets nervous being an advocate for family medicine and making the pitch to this guy. I can feel that in your voice. And I think especially the first time attendees will be able to relate to that and said, this guy's been around forever. He's like a superstar leader, and he still gets nervous. I think, the first time attendees will really relate to that. And the other thing too is that I predict that, during this lecture and following this lecture, there's going to be, a huge spark and a renewal of interest in the history of our specialty, the history of family medicine. Because, I admit, I don't know much about the history of it. I've talked to a lot of people who have tried to teach me the history of it, and sometimes I tune them out and sometimes I pay attention. But I think with this lecture coming up on Thursday, it's really going to get people curious. It's really going to get people excited to learn about the history and how things really haven't changed that much. The fundamentals of family medicine, they're the same. The story that we tell now is similar or the same to the story that we told back then. And I know I'm getting excited about it just thinking about it. And I'm thinking even on my blog or even on my website to start relating back to those stories and to go to NCSC to talk to those people who know those stories, even some of them firsthand, to tell the story so that you and I can help relate the story on social media. I'm very excited.